We'll continue with part two of chapter 8, environmental change strategies. Okay, so we have to think about what we're asking people to do within our program. And most likely it's going to involve behavior changes. So again, with behaviors, these are actions. And there may be things that exist in the environment that serve as challenges or act as barriers to those actions from taking place. And we can also flip it around and take the perspective that there can be things that exist in the environment that facilitate or make it easier for the person to carry out the behavior. So again, we need to think about what we are asking people to do in terms of behavior change, and then in the settings that they find themselves in. Some settings are more conducive to that behavior change, and others are not. So we have to look and see, okay, well, what is in the scope of being realistic in terms of what our program can do to change the environment. But the idea here is, again, what can we do to facilitate the behavior changes that we're asking people to make, that are part of our program. And while physical environment is often the first thing that comes to mind, there are other, quote, environments that play the same role in terms of being a barrier or a facilitator. So the economic environment, right? So if we were asking people to eat healthy, right, one of the main things we hear back from them is that it's too expensive to eat healthy. So again, that's the environment, kind of subset of issues or factors that we want to look at in terms of when you suggest things like making services free or having access to low cost healthy food ingredients. That's something that we may want to consider, because I think you can recognize how high costs can prevent someone from utilizing that particular resource. So, again, what can we do? Sometimes it's a perceived high cost, sometimes it's an actual high cost. And regardless, the person, whether they perceive it or it's real, it's still going to serve as a barrier to them. Service environment, right? So there are a number of community programs that are available, but just because they're available doesn't mean that they're utilized, right? Maybe it's something as simple as a transportation issue. Maybe it's something as simple as people not even being aware that certain services are available. So anything that we can do to enable the individuals to access those services, again, that we may be removing barriers that prevented the use. Social environment. Okay, if you look here, social support and peer pressure, right? Think about the influence of peer pressure, especially against the behavior change that we want. Right? It can be very powerful. We also have to consider the individual's locus of control and self-efficacy to resist peer pressure. That's certainly a consideration. Social support is a big component, should be part of every program, but basically you want people to form groups, whether it's outside the program or maybe within the program, that we all encourage one another. We all can serve as resources if a person has a question about the behavior change and kind of their progress through. But the idea is that you don't want the person to feel alone in this behavior change. Right? You want them to feel part of a collective, and that there are people that are supporting this change. The cultural environment, again, this is can be tied into ethnicities. It can be tied in organizational beliefs and attitudes that collectively form the culture, similar in a way to how peer pressure and social support work. Through whatever we're identifying as culture, does that culture support our behavior change, or does it act as a barrier to behavior change. The psychological environment. Again, think of this one. We can water this one down. Think of how stress impacts our decisions to go out and do something. If we're feeling depressed, or if we're just not feeling motivated, right? That psychological construct, right, can be a very big barrier. So, understanding kind of where the person is coming from in terms of their psychological status, and how psychological status as it undulates through the day, it's similar to motivation. It sometimes we're highly motivated, sometimes we're not. Same thing with our psychological issues. Sometimes we're impacted heavily by our current mood or outlook, and and other times in the day, maybe not so much. But again, just recognizing that the psychological environment can also be a barrier or a facilitator. And then the political environment. Basically, what policies are in place to support this behavior change that we're after? We may be in a situation where policy really isn't needed, but there also may be situations where policy can work, as part of a bigger approach. For example, the tobacco-free campus policy. Um, you know, we recognize that policy being in place as being kind of important to getting more people to not smoke on campus than just having smoking cessation sessions, and that sort of thing. So environment, like I said, we quickly can go to physical environment and think about those types of things, but there's also other types of environment that we can also consider for change. Okay, with physical environment, I just want to introduce this term built environment. And here's where we, think about urban planners, right? You're trying to develop a plan for a particular community, city, whatever it is. With built environment, basically during that planning phase, you're considering how we can plan things in a way to make it more convenient for people to engage in certain behaviors. You know, Looking at land utilization and having outdoor spaces where people can engage in activities. Looking at billboard restrictions, not allowing advertisement for tobacco products. With the layout of different community services, placing them in areas that uh, where they're more likely to be utilized, or where the need is greater. These types of things, planning and building the physical environment to support certain behaviors, inclusion of bike paths and things like that. So again, when you think about this built environment, what are we doing to facilitate healthy behaviors? And also, what are we doing to erect barriers to unhealthy behaviors? So these by themselves, this last bullet, what it's getting at is that you can create these healthy environments, but that doesn't necessarily mean that individuals are going to make the behavior changes that are desired. So just like health education isn't going to be that effective on its own, right? Just creating a built environment that's supportive of healthy behaviors is not going to be effective on its own. We have to take this multi-dimensional approach to behavior change, and kind of bring in as many considerations as feasible, in order to put us in a position where we're more likely to see success among our target population in terms of health outcomes, behavior changes, and those sorts of things. So if you only have one strategy, or two strategies, well, your program's probably, and I say this, in general, probably not going to be as effective at producing a health outcome change than a program that involves, even more strategies. But also keep in mind, there's a tipping point. You can have too many strategies, which can be distracting to your target population and can be distracting to those that are administering the program. So, you just have to find a balance somewhere. But the idea is that if you have a plan, then each strategy should serve a purpose, and you should be aware of what that purpose is. Um, if you're bringing in a strategy and you really can't identify the purpose of that strategy, or you can't recognize the complete benefit of that strategy, you may want to think about, do I really need to include this strategy, because it's going to consume resources. And if something consumes resources, then you want it to impact your program success in a positive way. Okay, health-related community service strategies, very similar to environmental strategies. We're looking to see within the community or organization that we're delivering this program, are there partnerships that we can form that give us access to resources that the partners have? So within the community, right, there may be, I don't know, maybe a local hospital, maybe a local clinic, maybe a government agency that does offer certain services, and we can partner with those organizations to kind of go over the availability of services within our program, address, how to access those services. We could address, the purpose of the services. So again, we can extend what resources we have by forming partnerships and utilizing outside resources. So, HRAs, HHAs, health risk assessments, health hazard appraisal. These are basically needs assessments that we could tap into. Clinical screenings. Different organizations, offer free screens. Sometimes at job sites we have health fairs where you can go around the different booths and you sit down, you get your blood pressure, cholesterol, glucose, usually very simple. We did a worksite health promotion program where we brought in nurses from the local community hospital, and they provided cholesterol and glucose checks at a very reduced cost because of the partnership we formed. And the idea is we were able to not only get a sense of cholesterol and glucose among our target population, but individuals in the target population that participated in the screening, they also got results and could see kind of what their status was. We're coming up on flu season, right? Think about in your own community, okay, how you would go about getting a flu shot, right? A flu vaccine, right? Sometimes you can do it through your personal health provider, right? You're there. You can maybe schedule up an appointment, or maybe you're there for some other issue and you mention, hey, are you offering vaccinations, and get it there. On campus, they offer free flu shots to members of the campus community, faculty, staff, students. Even locally, think about CVS and Walgreens typically offer free flu shots. I know I use Publix grocery stores. You get a flu shot there, and they'll give you a $10 gift card, to use at Publix. So, just making people aware of those services, and tapping into what other groups within the community are offering that aren't necessarily a part of your program. But basically, you're just trying to reduce the barriers to the services. We had a discussion on food deserts, and kind of the overwhelming response was, okay, well, we'll make healthy food options available. Well, that's great, right? They have to be in place, but we also have to think about how they're going to be utilized. Can they be utilized, or is the perception there that individuals in the target population can actually access these things? So it's a, like I said, it's a comprehensive approach, but it's something to think about. And then this last bullet, the issue with health fairs and these free clinical screening is even though the individual receives the results, and you're able to identify, hey, these results are on the kind of the negative end of where you want to be. um, Maybe some helpful tips or some information can be provided, but not really able to make a diagnosis, and then come up with a treatment for care at that point. So basically you're relying on the individual to receive those reports, right? Be informed that, okay, here's how your status kind of measures out in terms of the normal ranges and things like that. But the next step is very important, right? The person has to follow through to speak with a healthcare professional or their provider, and get a diagnosis. And then oftentimes that second part doesn't go through, or the person never follows through and seeks out more information. So if you're going to utilize clinical screenings and health fairs, right, you want to have an opportunity to follow up with those individuals, just say, hey, just checking to see if you're able to speak with your physician or healthcare provider about your results. Again, it's an opportunity to encourage them to do so. But just getting a result and not doing anything with it, there's not really a lot of benefit that's going to be realized. Okay, community mobilization strategy. So here we're focusing on, first thing we have to do is define what we're calling the community, so that we can identify who the members of the community are. But with community mobilization strategies, basically we're using that infrastructure, that dynamic that exists in the community, um, as a way to address existing health issues. So if we look at community organizing, so if you look through this definition, basically that's what the program would be doing, would be serving as an organizer, right, bringing people together, right, members of the community, to discuss issues that exist in that community, right? What are the problems? Then we're going to look within the community. Okay, what are the existing resources that we can utilize to address that problem? And then basically just organizing the effort from that standpoint. When we look at community building, here we're really focused on gathering resources, or bringing resources in that maybe don't exist at adequate levels. For example, with the opioid epidemic, communities are looking at neighboring communities and how they're dealing with the opioid epidemic. Okay, and one of the initial kind of rush to do things was to secure doses of Narcan, right, to stop the progression of overdose by binding or metabolizing the opioid so that the person opioid levels decrease. So communities are looking at other neighboring communities to see how effective that was, and they're saying, you know what, we may not be in the midst of a opioid problem right now, but if we look at trends, probably our community is going to be affected by this. Let's go ahead and start to build up reserves of Narcan. So that's what I mean by strength-based, is gaining strength, and you do that by bringing in resources to deal with issues that could potentially impact your community. And by having resources available, having a plan to deal with that already kind of worked out, you're more likely to minimize the effect of those issues. And then community advocacy. Really, when I describe this, I think about in terms of political decision making, meaning that you have elected officials that they're making the decisions on how resources are utilized. Community advocacy efforts would be, again, bringing people together in the community to speak with a single powerful voice to let those decision makers know, hey, here are things that you need to be considering every time you make a decision on resource allocation or what services to offer, that sort of thing. But the idea is that decision makers, they're representative of the people that elected them, right? That's how it's supposed to work, and they're supposed to make decisions that are in line with the people that elected them. So by creating this powerful singular voice, right, you're letting those representatives know, okay, here's what the community wants. Right, you need to make decisions that kind of fall in line with meeting those particular needs. Okay, so how do we go about organizing, this voice, this message from the community? Well, influencing voting behavior. Here is where it's more about getting people to participate in the voting process, whether this is getting people registered to vote, letting them know where their polling locations are, maybe informing them on how to fill out the ballot, not in terms of what to check, but kind of getting them familiar with, here's what it looks like. Here are the candidates you choose from. You pick. Here's how you indicate which one your vote is to be cast for. Here are the dates. You have early voting starts. Here's the deadlines. All those sorts of things. And the idea is that you want them to get engaged with the voting process. Right? That's the behavior we're after. Electioneering would be where you help people identify the candidates that are running on a platform that is similar or in line with the views and priorities that you have, right? And you can cast your vote towards those individuals with the expectation that they're going to follow through with those campaign platforms. Direct lobbying. Here's where you go directly to the decision makers, right? And you try to convince them that your position is what they should be considering and when they're making these decisions. Integrating grassroots lobbying into direct lobbying efforts, right? So at FAU, we have lobbyists that are up in Tallahassee, meeting with representatives and decision makers and kind of pleading our case. Here's again, trying to convince them that our issues need attention and that and attention can be delivered via the decisions that they make. Not everyone has access to decision makers in the same way. So by integrating grassroots, so if there was a student led coalition on campus that had a list of student needs that need to be addressed, having them convey those wants to the lobbyist so that the lobbyist can include those during their meetings with decision makers, right? That's what we're trying to do there. Use of internet, right? It's no secret that the internet and social media platforms are far reaching. Sometimes making people aware that situations currently exist. Maybe that compels them to act on that. But basically, getting the word out, letting people know that, hey, this is a significant problem. How they know it's a significant problem, because they can look and see, well, there's a lot of people behind this. Media advocacy, in terms of newspapers and getting stories out there in the media. Again, you're reaching a lot of eyes and ears with the hope that more and more people will kind of side with your position. And then media advocacy, acting as a resource person. Sometimes media contacts you and basically they want your perspective on a particular health issue. For example, our department was just contacted to identify a person to kind of put together an interview for an article on how to work out at home, that sort of thing. But we're part of the FAU community, the Boca community, the South Florida community. So again, we're considered resources within those communities. And here's an example of how media advocacy and selecting a resource person to develop information for the community. That's how that strategy can be exemplified. Okay, some other strategies, behavior modification activity is probably going to be a big part of most of your programs. Is going to involve some behavior change. But if you just keep in mind that behavior change is a process, right? It occurs over time. There are techniques that you can utilize to assist with people making behavior change. That always has to be going, rattling around in your head is how can I make this behavior change easier for my target population? Um, because it is a process, you'll probably want to track that process or progress over time. Um, doing activity logs. That may assist you with process evaluation later on. But the point here is that let's get away from this idea that if we provide health education, why the behavior change is important, and we tell our target population, okay, well, now that you know why it's important, go out and make the behavior changes. That's not going to be enough to get people to change behaviors, right? You have to come up with a sophisticated approach, right? With this end goal in mind is that when the program ends, right, you want people to maintain those behavior changes that they make. How are you going to do that? What makes sense to you? So the idea here with behavior modification is you know evaluation, right? Collect your baseline data, identify the variables that you're going to track over time, how you're going to analyze progress through the behavior change. So you can start this to align, okay, what program strategies were effective, what weren't so effective, what else could I have done, right? You want to utilize the data in a way that's meaningful and helpful to what you're trying to do. Organizational culture activities. So culture, we're not talking about it in terms of ethnicity at that point, but we're thinking about, okay, an organization, right? So an organization is made up of members. So at FAU could be an organization made up of faculty, staff, and students. Where you work is an organization where membership is made up of all the employees. If we think of ecological perspective in that organizational sphere of influence, right? That's what we're talking about here. So basically, it's the collective beliefs and attitudes of all the individuals within the organization, right? They kind of get summated, and there's like kind of a dominant way of thinking in terms of how we go about doing things. That's the culture. If at your work site, where if healthy behaviors are really encouraged, I mean, maybe it's not written down anywhere, but it's just a general sense you get with interacting with all the various individuals within the organization. You see that, okay, healthy lifestyle is something that's important. I don't know, maybe if you worked at what is that, Lululemon, maybe working in that store, you would think there'd be a lot of like-minded individuals and healthy lifestyles or something that's valued. It'd probably be difficult, right? Maybe the perception is for you to go out in the lunch break, go to the food court, come back and go in the break room, and you're eating pizza, and you got I don't know us, but a big unhealthy lunch, and everybody else in the break rooms, eating apples and celery and that sort of thing. You're probably going to feel like, ugh, I'm kind of sticking out here a little bit. That's the idea behind organizational culture. Um, sort of like peer pressure, right? Everybody kind of wants to go in line with what everybody else is doing. Well, organizational culture is your sense of what everyone else is doing. Now, if you can create a healthy organizational culture, or an organizational culture that values healthy lifestyle, that's going to be a benefit to you, getting individuals within that organization to carry out healthy behavior changes. But it can be difficult to change if you're starting off with an organization that maybe doesn't value those sorts of things. How do you instill that? It's difficult, right? Because we're collectively changing beliefs and attitudes, right? That takes time, if even possible at all. um, okay, let's look at this last bullet. Should begin with an assessment of cultural audit or cultural audit to determine if the culture hinders or supports health promotion. So I've developed a couple different instruments to measure. um, I use the term climate. All right, so culture is the overall collection of beliefs and attitude. When we use, say, a cross-sectional survey to measure those beliefs and attitude, what we're measuring is the climate, right? Climate's a point in time, and the idea is that climate may or may not fluctuate over time, but the overall, if you summated all the climates, you're going to get the culture. In the worksite, I developed an instrument to measure health climate. Basically, it's it's built around the theory of planned behavior. Usually, so I'm assessing attitudes towards the behavior associated with healthy lifestyle, assessing subjective norms, perceived behavioral control. Even there's even an intention subscale about whether or not a person intends to make healthy behavior changes within a certain time period. But we can measure culture, but not culture per se. We measure climate, which is reflective of culture, but it is at a single point in time, and that's how you would measure changes in culture. Utilizing incentives or disincentives. Um, yeah, so incentives are good, right? Think about what we're trying to do. We're trying to create motivation to do or not do something, right? To do something, we use incentives. I guess we use disincentives either way, right? So rewards are incentives, consequences are disincentives, and they can indeed be powerful motivators. But the issue is you don't want the incentive or disincentive to be the sole motivator, right? We're talking about healthy behaviors where the individual is going to realize the benefits. The motivation needs to come from within the individual. Now, incentives and disincentives is usually effective at getting people to initiate the behavior change, but if you rely solely on incentives or disincentives for motivation, once those incentives or disincentives go away, so does the motivation, right? And oftentimes we see the behavior change stop. So if you're going to use incentives and disincentives, my recommendation is to use it just initially to get people initiated in the behavior change, but then you need to start working on extracting the internal motivation, figuring out what that is, and then focusing on that. That's going to give the person the best chance at maintaining this behavior change over a long period of time. Behavioral economics. This part of behavioral economics is very helpful at getting people to kind of understand that people do not rely strictly on logic to make behavioral decisions, right? So if people make decisions strictly based on logic, right, and say we're talking about smoking cigarettes, right, we can present the logic why they shouldn't smoke cigarettes, right? And if that's all that went into the decision making process, right? The person, okay, well that makes sense. Let me stop smoking cigarettes, right? So, and health education tends to be, focused strictly on the logic behind making the decision. Well, hardly any of us make decisions based strictly on logic, right? So if that's the case, then what else should we be looking at when we're trying to understand why people are doing the things that they're doing, right? So some things to consider: are more concerned about avoiding losses than acquiring gains. Again, think about if the person gives up a behavior or makes a behavior change, right? They tend to focus on, okay, what am I giving up, right? Because that's real to them. What they're going to gain, that's kind of a concept, right? If you say, look, you're going to have lower blood pressure, you're going to have um, higher VO2 max. Those are abstracts to a lot of people if they don't already possess those things. What they're looking at now is, okay, here's what I have, or here's what I gain from smoking. Um, I'm going to give those up in exchange for these conceptual benefits that you're presenting. Um, that can make it difficult for a person to make a decision to give up the benefits, the perceived benefits they have from the unhealthy behavior. They're comfortable with status quo and do not want to change. That can be said for all of us in a lot of different situations, right? Most people do not like change, and why is that? It's because change, status quo. Let me go back. Status quo just implies that we're routine. We're involved in routines. Our days are built around routines. Routines, right, is a function of the limbic system. Change involves cognitive processing, right? We have to keep track of what we're supposed to do differently, how we're supposed to do it, those types of things. That's prefrontal cortex. That can initiate the sympathetic nervous system, right? Cause us to feel uncomfortable, anxious. Basically, if there's no change and we stick with our routine, we really don't have to think about a lot of things. But when we do introduce change, now we got to be present in our thought and actively consider it. So getting people to change, that's a difficult sell. Aware of social norms and want to conform. I think a lot of us can relate to that. Experience decision fatigue, choice overload, right? Not knowing what to do, not knowing what the best decision is, not knowing how you're going to incorporate this decision into your life, right? At some point, I think we've all been struggling with decisions before and just get frustrated that we can't, come to a clear answer that we're on board with. Heuristics, right? Shortcuts or quick answers because of decision fatigue, right? We basically decide on the path of least resistance just to make the decision process go away. Having trouble evaluating possibilities associated with health decisions, not seeing the big picture, or maybe we've been presented with consequences using a lot of terminology we're not familiar with. Overvalue the present outcomes of decisions and discount future outcomes. Present bias. Basically, here's what I'm dealing with. Here's what I know. You're asking me to consider things based on things I'm not familiar with. Again, these are all the things that kind of get invoked when people are making decisions that go beyond logic. If you're working with information protected by HIPAA, the Health Insurance Portability and Accountability Act, um, you have to be cautious about how you're using health status and as an incentive or disincentive um, as it relates to accessing that insurance. A couple things to consider. Um, protected health information, right? That's what HIPAA is designed to kind of keep confidential. Uh, but the Genetic Information Non-Discrimination Act was passed in 2008 to include genetic information as PHI. Um, ACA, the Affordable Care Act, programs that are part of participatory wellness program, um, you can't really make them health contingent incentives where I mean you can't make the incentive be tied into part of achieving some health status. So you have to kind of balance protecting individuals personal health information when you are kind of considering incentives and disincentives. So kind of tricky to navigate. So you want to be aware if HIPAA, if you're in a situation where HIPAA does apply, and how you handle that data. Okay, so here's where I was talking about with Affordable Care Act. So participatory wellness programs, that's what we want to offer, right? People are free to choose whether or not they participate in the program. We wish them the best in their outcomes, but we're not tying in any incentives based on those outcomes, as opposed to a health contingent wellness program. That's the one where it gets a little tricky because we're saying, look, in order to receive the incentives or avoid the disincentives, right? Here are some target health status targets you need to meet. Um, Discrimination, that's something that we're trying to avoid, prevent. So that's why these health contingent wellness programs. We don't want to create a situation where a person is being discriminated based on their health status. Social support activities. I've mentioned this before. This is the big winner. Definitely include social support activities within your programs. Um, it's just the benefits, the encouragement that can come from social support activities is very great and can be very beneficial when we're putting together a program trying to get individuals through the program. We find that by putting them in kind of social situations, they tend to perform much better. Okay, so here we're finally at the point where we start talking about planning. But let's go back through the steps of how we've gotten here. Okay, so needs assessment. We have to begin there. We have to identify what are we going to focus on as it relates to what our target population needs. Then, based on those needs, we're going to develop our goal and program objectives. Right. So go back, make sure you're familiar with the different types of objectives, how to write objectives, and that sort of thing. Then for each objective, right, we want to think about, okay, well, what strategies are we going to use to help us meet that particular objective? We do that for all of them. Now, so say we're at a point where we've identified, okay, for this objective we need health education, we need environmental change, we need behavioral change, right? We've identified those strategies. Well, the next thing we need to start thinking about, okay, well, what are the specific activities that we need to engage in order to utilize those strategies? So a health education strategy. Okay, so what are we going to do, and then label that as health education. Environmental change. Okay, what are we going to do, and then label that as environmental change, and so on and so forth. So that's where the actual design comes into play. And then keep in mind, there's no one best way of intervening to accomplish a specific program goal. Right? There's going to be a lot of decisions that need to be made. There's prioritization that needs to be made. There's going to be decisions made based on what you're comfortable with, what you have experience with, what theory suggests you should be doing. So, and it's going to be highly dependent upon what target population you're working with. Um, you know, there's still a lot more that goes into it, but we're in a much better place than if we just started pulling things out of the air and kind of just randomly came up with a program, right? By following the process, we can avoid a lot of pitfalls that people run into when they basically kind of creating these things on the fly. Okay, so guidelines. Again, they're just guidelines, just suggestions, right? Addressing one or more risk factors of the priority population. A lot of times these risk factors are they cross over to different health issues, but the idea is that by removing risk factors, right, you're decreasing the likelihood of a negative outcome. Being theory driven, right, have some framework. Utilize that structure to help you make decisions and considerations as you're going through the program based on best possible evidence, right? Make decisions based off of things that are supported by the research or by the evidence, right? Evidence shows that programs that have social support tend to be more effective, right? That helps you make a decision to include social support. Adhering to professional ethical standards, absolutely. You're working with people. You always have to keep that in mind. They're people, they're human beings, right? You have to treat them ethically. The whole purpose that you're there is to make their lives better, right? You don't want to kind of trample on kind of the things that they're doing what they know just to produce some evidence of a successful program. You genuinely want to be there to help people. Being culturally appropriate, again, your decisions, your program, right? We want to help them improve their lives, but we want to do it in a way that they're comfortable with in terms of culture. Be consistent with professional criteria, guidelines for code of practice. They list ACSM, um, what is that? 30 minutes a day, 5 days a week of moderate to strenuous physical activity. But basically, the behaviors and the outcomes that you're looking for are consistent with standards and guidelines from the organizations that represent the discipline. Using resources efficiently, right? Just being budget minded, right? Trying to, I think the approach should be is getting the best results utilizing the least resources, right? That's efficiency. Um, don't go into approach where because it can get easy to do, well, let's throw more money at it. If we're not seeing um, success in a timely manner, right? If you have resources available, temptation is to throw more money at it, throw more resources at it. That'll produce results. Sometimes it works out that way, but sometimes it doesn't. It's better to go back and understand why certain things aren't performing as you expected, and it may be for reasons outside of resources. 8, including an evaluation component, absolutely, right? How are you going to know how your program's performing if you haven't thought about how you're going to evaluate it? That's why when we set up our objectives, right, they're going to be measurable objectives. At that point, that's when we're thinking about how we're going to evaluate. Okay, just a visual representation of going through and creating and designing an intervention. What needs to be changed, where is change needed, right? Needs assessment. That's what's going to point us in that direction. Okay, once we identify what needs to be changed, now we can consider the level of prevention. Is this a primary, secondary, or tertiary approach, right? That's going to help us determine kind of the extent of our prevention efforts. Um, what levels of influence? Okay, what levels of influence do we have as programmers? What level of influence is significant to creating change? One of the things we want to look at there is, has someone been here before? Has someone created a similar intervention for a very similar target population? Um, if that's the case, right, then we would utilize best practices, right, where we start to incorporate some existing programs that have demonstrated success that we feel are applicable. Um, In lieu of that, you know, what's the experience of the people that are working in the program? Have they worked on similar programs? Have they worked with similar populations? Well, let's get their input on program design. But at the very least, we would rely on best processes. Best processes just means that you're taking a theory-based approach. Because that's all you have at the moment. There are no demonstrable successful existing programs. No one on the program team has experience in this particular situation. So at the very least, we're going to design our program utilizing theory concepts. Um, Once we take that approach, then we think about, well, what strategies are we going to utilize? Again, keeping our objectives in mind. How are we going to meet those objectives? Are they appropriate for the priority population? Um, you know, Making sure that we've tailored our decisions and strategies to the particular needs of the target population. Are resources available to even carry this out as designed? Maybe it is, maybe it's not. If not, can you get more resources? If you can't get more resources, then you're going to have to backtrack and maybe rethink how your approach is going to be in this program design. But once you kind of work those all out, now we start to have the formation of a planned intervention. Okay, so I use some of those terms going through that diagram, but best practices. Again, think about what we're doing. We're trying to design a program. Are there successful programs out there that we could model from? Right? They've kind of worked out a lot of these steps, presumably, and no need to reinvent the wheel in those cases. But you always have to be cognizant that just because they demonstrated success with their implementation doesn't mean that you're going to see success in your implementation. There's a lot of variables that go into that. People, right? The target population you form, while they may have similar characteristics of the previous target population used in the intervention that you're thinking about incorporating, there still could be a lot of situational differences that are going to alter performance. Best experiences. Again, maybe you read about an intervention, maybe it wasn't that successful, but in your mind you've kind of worked out, okay, well, here's why they probably weren't successful. So I'm still going to do elements, but I'm going to modify them based on what I know and understand about how these things could be used. And then best processes. Here we're just using theory to help guide our decision. So selecting appropriate theories or theories. Again, that's something you're going to have to work out. Segmenting. So the idea is that we want to tailor the program to the specific characteristics of our target population, and just know that by narrowly defining our target population, adding more characteristics to the description of our target population, we're segmenting the larger general population into something smaller, or a group that's smaller that we can work with, and we can highly tailor our program around those membership characteristics that we've identified. And then culturally sensitive. Again, your program actions fall in line with the norms and traditions of the target population that you're working with. Remember, people don't like change. People don't want to be felt like they're being excluded based off of certain beliefs and that sort of thing. So you want to kind of take that in mind and incorporate that into your considerations. All right, so this figure kind of carries or describes kind of the general process you would go if you're considering best practices. Okay, so under the assessment phase, right, you do your normal needs assessment, so you understand your target population, stakeholders, what interventions are out there. The goodness of fit, just says, how does the uh, existing interventions kind of align with your target population, your stakeholders, perhaps even an organization. And based on that, you select either you adopt an intervention as it's designed, or adapt an intervention where you incorporate elements of an existing intervention into your design, or select another intervention, or this not it doesn't show up on this figure, but it could be you create your own intervention that's there. Okay, so prepare. Okay, so if you're going to use an existing intervention with some changes, right, what are those changes, right? Go ahead and make those. That's the adaptation. Uh, if you have this luxury, pre-test your intervention with the target population just to see how well it would be received, identify any challenges or barrier. Um, Go ahead, if you're delivering this within an organization, go ahead and start your preparation. So if you're going to deliver a program at FAU, right? FAU, there's a lot of policies in place. You may have to reserve space. You may have to bring in university services like AV or food services or whatever. Anything that needs to kind of be set up before the program needs to be is implemented. Okay, again, if you can do a pilot, awesome. You can learn a lot from a pilot. Okay, but just recognize that's going to consume resources, time, money, those sorts of things. And then implement. That implement simply means that, okay, you start the program. Okay. Down at the bottom, feedback loops, checkpoints. Basically, you're reacting to what you learn in each phase, and maybe going back and making some enhancements so that, again, you're setting yourself up for program success. All right, so limitations. Okay, don't think that just because you put in all this work designing this program that it's guaranteed to be successful, or it's guaranteed to be cross over a minimum threshold to designate success. It comes down to this: behavior change is difficult, right? Even the most well thought out plan still don't remove all the difficulty individuals may have with making a behavior change. So, um, just expect that. Not being as successful as you anticipate, that's a reality. Um, Most interventions come with some limitations. Usually when we're sitting down designing an intervention on paper, right, you have a blank slate. You know, you can even allocate resources much easier on a spreadsheet than when it actually comes time to implement. I know when I'm coming up with budgets, uh, I often underestimate the costs of different services and things like that. As much as I try to be accurate, there are fluctuations in those types of things. So there's a lot of things that can get in your way that are going to impede your pathway to success. But um, there are some things that we can utilize to be benefit. Technology is constantly changing, and technology that allows us to reach people, inform people, right? That's always something that we can utilize, and we can recognize that they are very effective if used appropriately, right? So when we're selecting technology, right, you want to pick something that has demonstrated effectiveness and it's reliable, right? There's nothing worse than using technology and the technology crashes. Um, Now it may be related to something outside our area of expertise, right? We need to bring in technical personnel to kind of figure out what's going on. Acceptable to those whom they were intended. It's got to be something that people are familiar with, or at least comfortable with. Easy to use, right? If you invoke technology that's so difficult drill down to where you need to be in order to utilize it, you're probably going to discourage a lot of people from using it. You're using the technology as it was intended, as using it properly. Otherwise, you may not see the benefits that are possible. Okay.